Congratulations! Your annual health screening is a vital part of your preventive health plan. Every year, nearly 100,000 individuals join HealthFair on the road to better health. HealthFair has been serving clients nationwide since 1998. As the only mobile screening company accredited by the prestigious Joint Commission, HealthFair strives to ensure superior quality and dedication to customer service. HealthFair's heart disease, stroke, and aneurysm prevention package is comprised of 6 tests. These screenings provide our physicians with an in-depth view of your cardiovascular health. HealthFair tests are a great complement to your annual physical. We encourage you to take a copy of your screening's results to your next doctor visit and have them added to your medical record. Here's what to expect during your screening exam. The echocardiogram is an ultrasound video of the heart showing the valves, chambers, walls, and blood flow. It depicts the resting function of the heart. This is considered the best and most accurate non-invasive study to obtain a great deal of information about the heart. For your echocardiogram, you will be given a gown and asked to undress from the waist up. The ultrasound technician will apply a small amount of gel and will gently use the ultrasound probe to obtain multiple images of your heart. The electrocardiogram, or EKG, provides a picture of the electrical activity responsible for the heart cycle of contraction and relaxation. 12 leads will be placed on your chest, arms, and legs so that the heart can be viewed from several angles. What can this simple and painless test tell about the heart? Plenty. By evaluating the heart's electrical activity, our doctors can see if the heartbeat is irregular, determine if the heart is enlarged, or even detect telltale signs of damage from a previous heart attack. The ultrasound of the carotid arteries evaluates the arteries in the neck that supply the brain with blood. 80% of all strokes result from clots that block the arteries in the brain, starving brain tissue of oxygen and nutrients. Furthermore, 80 to 85% of these clots originate from plaque in the carotid arteries. The amount of plaque is a good indicator of stroke risk. The Arterial Stiffness Index, or ASI, measures for the presence of atherosclerosis. Atherosclerosis reduces the flexibility of the arteries. The higher the ASI, the more likely you are to have hardened arteries. Why is it important to know how flexible the arteries are? Arteries are responsible for moving the majority of the blood through the vascular tree. Consequently, hardened arteries cause the heart to work much harder when it is forced to push blood through partially occluded vessels. This extra strain on the heart and associated blockage are a root cause for cardiovascular disease. The ASI is performed by placing pressure cuffs on your upper arms. The ankle brachial index test is a quick, non-invasive way to check your risk for peripheral artery disease, or PAD. PAD is a condition in which the arteries in your legs or arms are narrowed or blocked. People with PAD are at a high risk of heart attack, stroke, poor circulation, and leg pain. The ankle brachial index test compares your blood pressure measured at your ankle with your blood pressure measured at your arm. The abdominal aortic aneurysm ultrasound is an ultrasound of the aorta, which is the main artery leaving the heart and supplying blood to the abdomen. This test is used to visualize the presence of an aneurysm, which is an abnormal swelling or dilation of the artery walls. Danger lies in the risk of the aneurysm bursting or rupturing. Ruptured abdominal aortic aneurysms have a greater than 90% mortality rate. Do you know your numbers? What is Know Your Numbers? Know Your Numbers is a 5-year risk assessment that can help you calculate your risk for stroke, diabetes, coronary heart disease, congestive heart failure, COPD, and lung disease. What is Know Your Numbers? Comprehensive, personalized 6 to 12-page report on your current health status. Predicts the likelihood of developing chronic disease over the next 5 years. offers a roadmap of which lifestyle changes are the most necessary for you. What's included? A lipid blood screening, total cholesterol, HDL, LDL, triglycerides, and glucose. What's included? Blood pressure, height, weight, waist measurement, BMI, health questionnaire, immediate participant reporting. Immediate participant reporting. Current health status. Chronic disease risk. How to change your risk. Online access. Be sure to add Know Your Numbers to your package. Our physicians strongly recommend combining Know Your Numbers with our 6-test ultrasound package because it gives you a good overall picture of your health. It goes beyond a simple blood screening to give you an overall picture of your health and what you can immediately do to improve it. Ask your HealthFair technician about how you can add Know Your Numbers to your screening exam.
Additional services available. Prostate cancer screening, PSA. Nearly 1 man in 6 will be diagnosed with prostate cancer during his lifetime. The PSA screening is a simple fingerstick test that can detect abnormalities of the prostate, including cancer and prostatitis. Thyroid screenings, TSH. Thyroid abnormalities can cause weight gain or weight loss, tiredness, and other symptoms. The TSH fingerstick screening measures the thyroid-stimulating hormone to detect thyroid gland problems. HSCRP screening. Individuals with elevated CRP levels have a 2 to 3 times greater risk for cardiovascular disease than those with lower levels. Ask a HealthFair team member about adding these blood screenings to your package. A1C. What does your A1C test tell you? The A1C test is used to determine your risk for diabetes and to help you determine how your diabetes treatment and control plan are working. Ask a HealthFair team member how you can add the A1C test to your screening. Colorectal cancer take-home kit. In their early stages, colorectal diseases such as cancer, ulcers, hemorrhoids, polyps, colitis, diverticulitis, and fissure may not show any visible symptoms, even though they may be producing blood hidden in the stool. Why test yourself for stool blood? Our colorectal cancer take-home kit detects this unseen blood, which serves as an early warning signal of bowel troubles that need medical attention. Ask a HealthFair team member about our colorectal cancer take-home kit. CD of ultrasound images. A CD of ultrasound images can be added to any ultrasound screening package. The CD shows moving images of your echocardiogram and digital images of your carotid artery ultrasound and abdominal aortic aneurysm ultrasound. This CD is very beneficial in preventing retesting, and your physician can use it for comparison studies in the future. Ask a HealthFair team member about adding a CD of images to your screening package.
Thank you for choosing HealthFair. You're on the road to better health.